One of the most common procedures I perform are breast augmentations. But a question I get a lot is, what is the biggest complication with breast augmentations? And that would be the capsular contracture. It's what we all fear as both the patients and the doctors, and we want to try to avoid this. What can we do to help avoid or treat the capsular contractures? Number one is avoid infections in the early postoperative phase. We're not exactly sure how capsular contractures form, but what capsular contractures are is a scar that forms around the implant, and for one reason or another that scar could become thickened over time, and possibly infections could be a source for that thickening. So if you were to experience a cold or a flu immediately after surgery, I would recommend talking to your plastic surgeon and possibly going on antibiotics. In addition, once you develop that capsular contracture, there are some treatments that could be performed. First of all, I usually start my patients on an anti-inflammatory, and that seems to soften up the capsular over time. But should that capsular become thicker or painful, surgery usually is the next option, and that may either be a total removal of the scar capsule or a partial opening of that scar capsule. In the most extreme cases, we may have to place a mesh and remove the old scar and the old implant and place a new implant in there with the mesh or an internal bra to help prevent that capsule from coming back.